Welcome back to the channel. Today we will dealing the last topic of the impaction, that is maxillary third molar impaction. In this also I leave only a brief idea about the classification because rest all procedure are same. So let's start. Maxillary third molar impaction, Archer's classification. First is depending on relative depth of impacted teeth in relation to second molar. Okay, in relation to second molar. Class A, occlusion plane of third molar is in line with that of second molar. Okay, it has the same plane. Class B, occlusal plane of third molar is in between occlusal level and cervical level of second molar. Now class C, occlusal level of third molar is above the cervical level of second molar. Okay, this is very basic thing, but people do mistake here because in mandibular we see it's below the cervical line, but in maxillary when we see the classification or when we tell or when we write, it is always above the cervical level of the second molar. Okay. Now Venter's classification same: mesioangular, distoangular, vertical, horizontal, buccoangular or buccoverted, palatoangular or palatoverted or inverted. Now in maxillary impaction, the vertical impacted tooth are in more number, that is 63% accounts for vertical impacted tooth maxillary. Okay, then comes distoangular 25% and then mesioangular. Okay, but in mandibular impaction the more number accounts for mesioangular. Okay, now next, classification in relation to maxillary sinus. We have seen in relation to second molar, we have seen Venter's classification. Now in relation to maxillary sinus. Okay, sinus approximation position and no sinus approximation position. In sinus approximation position, there is no intervening bone or very thin bone in between sinus and tooth, and in no sinus approximation position at least 2 mm or more bone is present in between sinus and tooth. So this is the difficult one, this is the easier one. Okay, now surgical procedure. Usually an envelope incision is placed, vertical releasing incision only if impaction is deep. Okay, when impaction is deep then only we give vertical releasing incision, otherwise envelope flap or envelope incision is sufficient for removing maxillary third molar impacted. Never use chisel and mallet. This is also my personal opinion. Don't use maxillary impaction with chisel and mallet because it has a high risk of displacement of tooth in maxillary sinus, or it will cause some or other trauma. This is my personal opinion, but normal extraction you can use, but that also very carefully, very carefully. Chisel and mallet should be used very carefully. Now rest or procedure are same depending on the cases. As we have seen in mandibular impaction, same cheese is followed in maxillary impaction, same complication we will see and same treatment plan we will see. So it's almost same, but ये थोड़ा classification different है and थोड़ा approach is different है because it is upper and lower teeth. Now that's all for today's class and that's all for impaction. We have finished impaction. Now I'll be shooting videos or giving videos or coming online next week. Till then, like, subscribe and comment. Mostly I'll be starting maxillary sinus for the next class. Bye. Take care.